Well, welcome to another edition of Nexus Connects Us. I'm excited for today because we are at the MedMark Studios here in Scottsdale, Arizona. We are kicking off season 2 with a bang by doing some live recording here today and here in studio. So you're going to see a little different look than the way that we usually do it, but we're excited about doing that. And I'm excited because today I have Beth Hamann with me. Beth is the CEO of Agave Sleep
and Wellness.
And she's got a practice here in Scottsdale and has been working in the sleep business for over 10 years for dental solutions with sleep apnea. Beth, thanks for being here.
It's wonderful to be
I'd love
here.
to hear about the practice and your experience because you didn't just start out in sleep, right? You had a dental practice for a period before.
Correct.
How about tell us that story?
I'd love to. So I've been practicing 38 years, 28 of which was primarily general dentistry, a lot of cosmetics, a lot of full mouth reconstruction, made a lot of beautiful smiles, enjoyed that very much. And about 10 years ago, I became very interested in dental sleep medicine and how dentists are can be part of a solution for medical apnea problems, sleep apnea problems. So started my training about 10 years ago. And I read every book I could get my hands on and went to every course I could go to, learned a lot from a lot of wonderful people who were trailblazers ahead of me. And now we have a separate practice that's dedicated just to treating people with oral appliance therapy for both sleep apnea and TMD. And I'm loving it. It's just so rewarding.
And your focus is now on the sleep side, right?
Exactly.
Because you've sort of you've expanded your family to include.
Yes. So I like to say I went from saving smiles to saving lives because really, and it's very rewarding. Fortunately for me, my son married a beautiful gal who is also a dentist and is a very good dentist, and she's joined the dental side. So now she's kind of leading off the dental practice, and I'm doing solely sleep now. Okay. And the two practices are in the same building in Phoenix, and we have a little secret door between the two, so we're able to work together and share some of the equipment. But basically, she does the dental side, and I do the sleep side, and I love it.
I love that. So let's talk a little bit about why you made that transition. Was this because I've talked to a lot of dentists since we started this show, and I think dentists, like many doctors, want to do a lot of research, right? They don't just jump. They're not just. Yeah,
they're very analytical.
They don't just go to a trade show and see something and like, sign me up, right?
Yeah.
It's a process. And
Absolutely.
I talk about this even with my dentist who's interested in getting into this practice. And he's like, I got to think about my 2024 plan, my 2025 plan. He's very methodical. And that's good, right? I mean, you particularly want, when it comes to dental, when it comes to doctors, you want them to go a little bit by the book, right?
Of course.
You don't want them to be fly by night and just sort of figure things out.
Right.
So what was the trigger for you? Is this being at a conference and hearing something about it? Is it reading something in a trade publication? What was that trigger that made you realize that there was an opportunity here?
Yeah, so actually, and I've heard this from many dentists that do this, actually it was pretty personal, family members. My mom had a stroke, and sleep apnea are very correlative.
Very much.
And my dad was suffering from sleep apnea, and wouldn't you know it, so was I. And often we're our own worst patient. We're treating everybody else, but we're not taking care of ourselves. So I was starting to struggle with some sleep disordered breathing myself, got very interested. And then, as I mentioned, I had a lot of mentors that had already started this, that I worked with, that I learned from. And it's just been it's a very different practice than dental. It's medical. Yeah. And so I think one of the keys for me was the fact that it's a separate practice. Yeah. And the physicians that refer to me and the physicians I work with know that it's a medical practice. It's not a dental practice. Right. We don't do any general dentistry there. Yeah. And it's taken 10 years now to figure out all the insurance, medical insurance, that's a bear. Sure. And to figure out how to best treat patients and how to best communicate with their physicians, because the physician is the person doing the diagnosing. Absolutely. And I'm the one that's doing the treatment based on their diagnosis. Now, because you've separated into two practices, and I completely understand that. I've talked to lots of dentists
through Nexus that still have them together, but they do have to treat medical very differently, right?
It's
Because
very
it is
hard.
different. And that's why I think in Nexus case of them doing the billing, that's helpful because it is a very separate practice. And in my consulting firm, I work with actually a vision surgery center that has, dozens of surgeons, and people get confused because they call in and they're like, here's my vision insurance. And they're like, this has nothing to do with your vision. And they're like, but it's a problem. Yep, but it's medical.
Yeah.
It's very different. So you've had to make that transition. And the best way for you to do that was to separate that out.
Mm-hmm.
Now, on your sleep practice, are most of your referrals coming from doctors, or are you getting some from your dental side still as well? Because you're asking those sort of triage questions when somebody's in the chair.
Very good question. About 50% of my new patients come from physicians.
Okay.
And we have about 50 physicians in the Valley now that are routinely
referring.
sending patients. But yes, the dental practice sends a lot. Why is that? Well, the hygienist and the dentist are looking in mouths all day long.
Right.
And they see things that even physicians don't see.
Yeah.
They see, vaulted palates. They see scalloped tongues. They see large tonsils. They see a lot of indications that this person should at least be screened and tested. Yeah. And then it's kind of fun for me because likewise, we see patients who haven't been to a dentist for quite a while.
Sure.
And I can encourage them to go to the dental side.
Yeah.
Get some of that treatment done too.
That makes a lot of sense. And I've seen that even being in the chair at my dentist and us sort of talking through solutions to sleep. Mm-hmm. And he's even started now like leading people back a little farther and recognizing very, very quickly that once you get into that sort of inverted position, and you go, every time you go to breathe, he's like, I got you. Like we found out that there might be a potential
And when dental
there.
patients are very relaxed, they do often snooze a little bit.
Absolutely.
And we see it and we hear it.
You've got the TVs up there with Netflix,
Yeah.
So I mean, that's part of the practice. And I think when people do get comfortable, they tend to get more relaxed.
Yes.
I think it's interesting with, because of that conversation, I think my conversations with my doctor are very different than my conversations with my dentist. If I'm in there getting a cleaning, we're having a casual conversation about life and things, and my wife goes in there as well, so they're sort of tying together stories between the two of us. And I think it really does make a lot of sense for dental professionals to be able to actually at least say to somebody, I think you need to get checked. Mm-hmm. And I know we're going to chat with Lewis here a little bit later, and being that Lewis comes from a background in this game as well, he was able to diagnose a family member that, fell asleep on the couch, and he's like, there's something going on here. So it is something where we can interject ourselves. And I think, and it is really important because you talked about how you can have a lot of other issues that come out later in life because of undiagnosed
very
sleep apnea.
Serious.
Brett Brocky, CEO of Nexus, we've talked with him about his condition and the things that have happened to him because of untreated. I have a very close personal friend right now that is really struggling with his health and probably is not going to have a very good prognosis. Not your typical patient, not the big guy, but undiagnosed sleep apnea for 30 years. And
very
now
serious.
Here he is in his retirement going, okay, I can't get on a plane. I can't travel. I can't do these things. He's had to get a pacemaker, all of these things because of an undiagnosed problem that if it had been diagnosed 30 years ago, he wouldn't be in that situation.
Absolutely.
So I think that's really important. Let's talk a little bit about let's talk about the process that you go through. So you're working with a doctor, that doctor's making a referral. You're bringing that person in. Are you sending them for an in-home sleep study, or are you sending them to a lab? How does that usually work?
It really depends, but I would say most of the patients do take a take-home test.
Yeah.
Take-home sleep test.
Yeah.
And we used to send people to the lab more often, polysomnogram. But the current take-home tests are becoming more accurate. They're easy. We're actually using the same unit that Mayo uses. We get great results with it. And then we have a board certified sleep physician who does our diagnosis and makes a doctor's order. It's like a prescription.
Sure.
And once we get that, we can get to work on it.
Device.
So and most medical insurances do cover this appliance. And Medicare, we do we treat Medicare patients as well. And most Medicare patients, I would say, have nothing out of pocket. Maybe a couple $100 out of pocket, but very reasonable. So there's really no excuse not to do it. Sure. Especially if it's serious, which
And so let's talk about this for a minute. Like, what is the extent of sleep apnea that can be treated by a dental device? Because there are CPAPs and there are people that aren't eligible, right?
Yeah. The general guideline is mild to moderate.
Okay.
And this is first treatment.
Okay.
Or appliance.
Okay.
For people severe, that's over 30 AHI, which means more than 30 times per hour they have an event.
Sure.
Then we like to encourage them to try the CPAP first.
Okay.
50% of people that do try the CPAP first, a year later, they're back in my office.
Yeah.
They just can't tolerate it. Yeah. They fight it. There's all kinds of reasons that Darth Vader masks. There's a lot of
it's not
difficult.
Easy.
The other 50%, God bless them, they're doing the right thing, right?
Sure.
But for those that can't use it, they're intolerant, they're non-compliant, then they come back and then we use the oral device. Now, some of those patients get fantastic results with the oral device.
Yeah.
Others get maybe only 50%. Well, 50% is better than zero with a machine underneath your bed getting dusty,
exactly.
right?
Yeah.
But we always say, you have to decide. This is your health. This is your decision. Are you happy with that 50%? Or I try to encourage them to do what's called combination therapy, which is where we do get them back into a machine. Usually it's an auto PAP with a smaller window of pressure. Because a lot of times the reason they can't tolerate the CPAP in the first place is the high pressure. So I keep that in my back pocket because I want them to get the best result. And I don't want to push it on them up front if they say, I can't wear a CPAP. Patient's right.
Sure.
I'm not going to say, oh, yes, you can.
Yeah.
But there's been quite a few patients that have done fantastic with the combination therapy or appliance to keep their jaw forward, but a lower pressure. It's the best of both worlds.
I had never thought about that. And that is a really hard, I have two friends right now. One is a former NFL player. One is a former NBA player. Both of which are in way better shape than I've ever been in my life. I mean, they still have the 6 and 8 pack. It might be a 4-pack now. They don't have, but both of them have really serious sleep apnea, and neither of them are compliant. And it's a real challenge because they just cannot stay compliant with it because of the pressure. And it definitely is something that if you're not used to it, it's really tough. And particularly I'm a side sleeper. To use a CPAP, I have to sleep on my back, which just doesn't work.
Yeah,
I struggle with it.
That's the worst position to sleep from an airway standpoint.
Yeah, and I just can't get comfortable with it any other way. So I sort of get stuck in this, trapped in this place. Yeah. And that's why the dental device for me has been really amazing.
Wonderful.
It really has solved the problem. And I think it gives so much more flexibility too. I travel a lot. I used to travel 50 weeks a year. Traveling with this machine and trying to set it up and putting a humidifier, it's not easy to do.
Right.
But popping that dental device in is really simple. I have to admit, we went to Yosemite here a couple of weeks ago and we got about 25 miles out of town. And I said to my wife, I think I forgot my dental device. She's
no.
Turn your ass around. We're going home, right?
Going home.
We're not going in. She's like, you'll be miserable. I'll be miserable. The people camping next to us will be miserable. The elk and bison will be miserable. Like we can't do this. So it really is something that I think that's important. And, I think the other thing that we've talked about so much on this show, and I know we had Lisa on last episode, is it's not just about the truck driver, ex-football players. You mentioned you've got sleep apnea. You do not look like
we have a lot of young people in our practice.
Yeah.
Long ago, I used to think I could predict when I saw someone walk into the room how severe their sleep apnea is. Sometimes no, you can't. Obviously, anyone that's big, higher chance. But we have young, athletic men that you would never guess. We have very petite women, very petite, small women. Sometimes that's an anatomical reason. There's an anatomical reason.
Sure.
They have a narrowed airway to start with. So it doesn't take much to close it. And anatomical issues are why sleep apnea has a genetic component. You can't choose your parents, right?
Sure. Yeah.
So we have a lot of patients who,
if we could.
If only we could, we'd all be looking better too, right? But we have a lot of patients who are figuring this out earlier, and I'm so happy for them because they're 30 years old, they're not 60 years old. And I say, you're going to be a different 60-year-old person because you're in the
100%.
chair at age 30.
Yeah.
You're not going to have to go through all the stuff that your dad did. You're not going to have high blood pressure, diabetes.
Yeah.
You're not going to be on oxygen when you're older.
Yeah.
And most of all, hopefully you're not going to die in your sleep, which I'm in the dental sleep medicine world. So I hear about a lot of the deaths that happen.
Well, we've had Sarah White, Reggie White's widow on the show, and just understanding that. And I think one of the biggest takeaways I had from that interview was not, yes, of course, it's tragic that Reggie died, and sleep apnea was one of the conditions that resulted, that caused that to happen. But one of the things that she said, which was really fascinating, is she's like, we always wondered. Reggie was one of the greatest football players of that time and of all times.
Hall of Famer.
Yeah. And she said, and to think that from the time he was 17 years old, we knew he had sleep apnea and he just wasn't compliant. So think of what this world-class athlete did on maybe an hour of sleep a night.
Amazing.
Imagine if he had done 8 hours of sleep a night.
Yeah.
I mean, it's just incredible what he could have accomplished. I mean, he caused amazing things, but there's always this in margin that you go, well, what would have happened if he would have got a decent night's sleep once in a while?
Yeah.
And I think that's a really big thing to think about, right? Is from a performance perspective, listen, we've all, had a bad night's sleep and know how it affects us the next day. Do that for like 5 or 10 years.
Yeah. Yeah. It adds
really,
up, and
really
it's hard
does.
on your body, and it's hard on your heart.
Yeah. And I think too, even think about your relationships, when you are tired, you're aggravated.
Absolutely.
You don't treat other people in your lives the way that you want to treat them. And that can turn into all sorts of other issues that go way beyond just your health. It can go into your mental health.
Sleep divorce. They're using that term now.
Are they really?
So a lot of patients that come to me, first time I see them, I always want to know, why are you here? What's your why? And a lot of times they'll say, my wife sent me in. My husband sent me in. It's usually the spouse who's seen them stop breathing. Yeah. Or is listening.
It was my wife that did it for me.
Or listening to snoring all night and not getting good sleep. I always say one of the side effects of snoring is sore ribs because you're getting poked all night, right?
Exactly, sure.
And so there's been a term that's been kind of floating around called sleep divorce.
Interesting.
Which is where couples happy together, but they're not happy in bed together because of the sleep apnea and the snoring. Right. So they sleep in separate rooms.
You have couples that are...
So for a while, I thought, well, what's wrong with sleep divorce? I mean, they're still happy together, right?
Yeah, right.
But the more I thought about it, not sleeping with your loved one, with your partner is not okay. We were made to have that closeness, that warm body. You feel safer. I feel safer when I'm with my husband than when I'm sleeping alone in a bed.
We all do.
And there's a lot of other things that go along with that. Shame and you're apart and who knows. But
no, I mean it's not a good relationship.
It's not good for your relationship. So when I can help someone with a simple device be able to sleep with their partner again, oh my gosh, that's so rewarding. And I've gotten a lot of flowers from husbands and men and wives saying we're in bed together.
Yeah, exactly.
And
so let me ask you. You say that about 50% of your practice is referrals. I mean, do you have any divorce attorneys yet that are giving you referrals? Maybe this is a whole new practice you need to get into.
It's actually a good idea.
Hey, Nexus, start talking to divorce attorneys and say, catch them really early.
Yeah, it's a very good idea.
This has to do with the fact that they're not sleeping in the same bed.
And then what happens once they've been wearing the appliance is they'll say to me, oh, my husband was out of town. So I thought, I'm not going to wear my appliance. And then I have a miserable night. Yeah. And that's when it's really working, is when they wear it, even when they're not in bed with their spouse.
Yeah.
And
that's
so
it's and I, my personal story here with Nexus is, as part of the season 1, I got a Nexus device. I had a snore guard before that was helpful, but I went through the process of getting the sleep study, doing everything. And I'll never forget Stan. I think it was about a week after I got fitted and everything was in place. He called me. He's like, "Did you notice anything different?" And I said, "Yeah, I feel like I have more energy." But my wife also noted is she's like, "You used to get up, 4 or 5 times a night to use the restroom. Now it's maybe once." Yeah. And I have to admit now there's been a couple of nights where I haven't woke up at all. And I'm like, that's good. Yeah. Right. Because that's just to get into those sleep cycles and the REM and all that kind of stuff, the more time that you stay in bed, the better you're going to sleep.
Right. Because you're not disrupting that sleep cycle.
Exactly. If you're getting up and you're getting out of it and you're, or gasping for air, I mean, that's the worst. Yeah. So it's great. It's great to have that device and to see how it's really affected my own personal life. And I know it has for other people as well. Absolutely. Let's talk a little bit. You've got some cool toys over there and some books. I want to bring those up. So let's talk about the books first.
Well, I read, as I mentioned, I read every book I can get my hands on that has to do with sleep. And I have a few favorites. This is one that I give to a lot of my patients, Why We Sleep, Matthew Walker. He's got a great TED Med Talk. If you're not a reader, you can listen to him. Awesome. This one is Breath by James Nestor. Also an amazing book. I've heard him speak too, but this is about how important nasal breathing is rather than mouth breathing. And when we treat patients, we're not just saying, here's your appliance, we'll see you in a year. We're working with them. I am their coach. I'm helping them with a lot of things besides just this appliance: sleep position, sleep hygiene, nasal breathing. Nasal breathing is so important. When you nasal breathe, the air is filtered. Nitric oxide gets injected into that air. Nitric oxide is a vasodilator, which means your blood vessels carry more blood. What's the blood carrying? The oxygen. You get more oxygen. And actually little kids that don't breathe through their nose, if they're mouth breathers, they don't get proper brain development because they're not getting enough oxygen. So we're even helping kids now.
So let's talk a little bit about kids, because you mentioned that. We've talked about it in some other episodes. And I was a little surprised that kids are being diagnosed with sleep apnea now at really high levels.
Absolutely.
How does that work? And tell us a little bit about that in your practice.
So evolutionarily, that's a word, kids tend to have smaller jaws. The jaws are, a lot of kids have a recessed jaw and smaller airways and higher palates. And especially if they are mouth breathing, they are setting themselves up for a lifetime of sleep disordered breathing. So if we can get those kiddos treated early and expand their arches and expand so their teeth are wider, so there's room for their tongue, so they've got a broad palate. The palate, the roof of the mouth, is the floor of the nasal cavity. So if you have a broad palate, you have more nasal volume, more flow of air. And any way we can encourage kiddos to breathe through their nose. So we've got lots of ways to help them with that, with appliances as well.
Sure.
But in terms of treating their sleep apnea, I have 7 grandkids, and I'm already treating one of them. Wow. He had big tonsils, and those tonsils are gone. So, taking out tonsils, adenoids, but also this expansion, what I was talking about. So we're trying to help kids not have a lifetime of sleep disordered breathing and all the consequences that come
and there
along
are
with it.
some, I just saw it on a podcast recently about devices that stretch the roof of your mouth, right? So that it helps you breathe better.
So as a small child has a pretty big suture still in their skull and in their the roof of their mouth, and so it's easy to do that expansion. Once we're adults, not so easy.
Yeah, that's really interesting. And I know that we talked about this, and we had a couple of experts in season 1 that talked about how there's some research now that's starting to show that the potentially part of the reason more children are being diagnosed is that the foods we're eating today are more processed.
Absolutely.
Right. And it's like, if I think about it, when I was a kid, we went out in the woods and grabbed a bunch of walnuts and hucked them with our teeth. And, we did those they don't.
So I wish I had brought another book called The Dental Diet. It's called The Dental Diet. And it's to help moms learn that once the baby's done nursing, and they should nurse as long as they can. Don't give them bottles. Don't give them, try not to give them sippy cups. Try not to give them these little squeezy. I mean, kids are even 5 years old are still having their snack in a squeezy juice thing, and they're not chewing. So the chewing of the teeth with hard, real foods, carrots, broccoli, whatever you can get them done, get them into it early, celery, that is actually helping broaden that palate. That's actually helping them with, that's going to help them.
So if I see a kid chewing on a shoe, I'm like, stick with it, right, bro. You're on the right game. But it is, I think it's really true. And I think we think about grains, we think about all the things that we process now. We don't eat, even when I was a kid growing up, there was a reason we used a lot of meat tenderizer because the meat was not very tender. Today we go to the store and everything's been engineered to be very, very tender and juicy and easy to eat. That just wasn't the case 20, 30, 40 years ago. So I think we do have to think about that. And I love that. What was that last book that you mentioned about the dental diet? Is that what it's called?
The book, the Dental Diet.
The Dental Diet. That is really, I'm going to read that because that sounds really fascinating.
It's fascinating.
Understanding.
And so much of it is parents just don't know. Parents are doing their very best. They're great parents, but if you don't know something, you don't know it, right?
Absolutely.
And so much of what I do is teaching, communicating.
Right.
Helping people understand things that they had no idea.
Yeah, I think when people are passively ignorant of something, that's no fault of their own. They just don't know.
They just don't know. Once you know,
now you're responsible because now you have to be actively ignorant and not to want to continue and not to want to improve that.
Yeah.
So it is something that we don't want to be, especially I think as parents, you want to set your kid up the best for their life.
Absolutely.
And if there's simple things that you can do when they're children and toddlers that are going to affect their life and sleep the rest of their lives, Wow.
As simple as going into your child's bedroom and watching them sleep.
Yeah.
Is the mouth open? Is the mouth closed? If the mouth's open, they're mouth breathing.
Yeah.
So there's a lot of things that parents just don't think to do. Sometimes you'll see a picture of a kid in a car seat with their mouth open, open wide. Yeah. And mom will say, "Oh, isn't that cute?" Like she has no idea. That's not cute at all.
That's a medical
condition.
Problem. Yeah, that's a really great point. Well, I love that. And I Beth, thanks so much. I think this has been so good. How do people find out more about you? And is it Agave
Sleep and Wellness?
Okay, Agave Sleep and
Wellness. And we're always there. I've got a great team, and each appliance is custom made. Each appliance is made for there's a lot. It's not one appliance fits all, as some people might think. Yeah. But we love people. We love to get to know our patients, and we love to work with them. And it's really a journey. It's very different than I always say. It's not like I'm going to take out your appendix and I'll never see you again. Because as we get older, and you'll find out this yourself. Yeah. The appliance.
Oh, I'm not getting older. I decided. I'm done. I've decided.
The appliance itself is a hard material. It's not going to change. Yeah. What does change? Well, our bodies change, unfortunately, right? Our BMI might change. Our muscle tone might change. So we see once patients are doing well with their device, we see them in 6 months, check their bite, check their appliance, make sure everything's going well. Then we see them once a year from then on. And so it's been 10 years now for me. So I have people in their second and third appliances, and they trust us. It's worked, and we have a lot of fun. We really have a lot of fun with
Beth,
relationships.
Thank you for being here, and thank you all for joining us on another edition of Nexus Connects Us. Make sure you like and subscribe. There's such great information here. If you're a dentist and you have some interest in what we're doing here, please feel free to reach out. And if you're a patient or a parent, get diagnosed. Go get a sleep study done and find out if this is something that affects you or your kids. Okay, until next time.
In the human race, and we won't stop dreaming. No, we won't stop dreaming. We won't stop dreaming.